and thank you for joining me today. Excuse my voice because I have a little bit of a cold. Are you able to hear me clearly?
I can. I'm
Okay.
excited about it.
All right, good. So, allow me to introduce myself. I am Natasha. I'm a registered nurse, CEO of iCare RN, which is a care management company. I started my business about 2 years ago, and I have grown in that space and now collaborate with other companies that are in the same space. And so today, what I wanted to do was to introduce you to the group that I started for nurses in chronic care management and kind of get a bit of your background as an RPM provider because nurses have a lot of questions, about RPM and CCM. So I wanted to introduce you because I have been fortunate enough to, meet and collaborate with you. And I wanted to kind of share that with my community, and so I would like you to kind of just introduce yourself and tell me a bit of your background and how you got into the health tech space.
Yeah, absolutely. Well, Natasha, thank you for this opportunity to speak to your team and the great and wonderful work that they're doing. Yeah, I didn't come by it the traditional way. I'm actually have a degree in engineering and computer sciences. And so I kind of went the technology route before I went to healthcare. And it was only when I had a couple of situations with family members. First, my daughter, who was born, spoiler alert, she's okay now, but when she was first born, she had difficulty from a respiratory standpoint. And we kind of had to go back and forth about the first couple of months after she was born to the doctor. And that's when I was exposed for the first time, really, for the first time, of the
Mm,
healthcare system and the complexities. And I said, you know what? There has to be a better way. And so I kind of got exposed that way from family, from first my daughter, and then later on, my dad, who suffers from congestive heart failure, dealing with doctors, helping him manage his process, understanding the behavioral changes that he needs to go through to manage his diet and exercise, really opened my eyes. And that was the opportunity for me to say, there needs to be a better way. And that's how I went down the path of telehealth and
mm,
eventually care management and remote patient monitoring type programs. So that's kind of how I built. And from there, with my co-founder, we built out our company, Synsormed, to help providers, nurse practitioners, to guide them in helping their patients and with technology and services to help them guide them through this process. And so that's kind of how I started. I'm not a doctor or a clinician, but I
mm,
see the hard work that you and your team, as well as your members here on this channel, all the work you guys go through. And so I'm just admirer of that. And hopefully, in some small way, we try to build something that makes sense for you guys as you guys are looking to scale in this new area.
mhm. So, very much like myself, I started because family members with chronic health conditions, as well as myself, I have several chronic health conditions. And I felt as a nurse, I needed to have more of an impact on my community. And so, chronic care management was that route for me. So, I'd like to kind of discuss the role of nurses in RPM and care management, where they kind of fit in and the value you see nurses bringing to the space of RPM care management.
Oh yeah, absolutely. I mean, and I was thinking about this and preparing for this conversation. I
Mm,
just realized that nurses are uniquely positioned to take advantage of this opportunity. One of the things, we do work with nurses on our staff, and we have nurses who kind of reach out to patients on our behalf. But things like wellness calls, right? The care that you guys go into, the preparation that goes into doing that is so key. The new things around motivational interviewing, right? Understanding how to motivate patients to better behaviors is
mm,
also a key opportunity for nurses to kind of be involved in that. Care plans, those are things that have been around forever, but definitely something that's taken the forefront. You're looking at personalized health plans, understand patients' exercise goals, barriers to healthcare, understand their motivations. Those are some of the key areas. as well as escalation. So if there's any issues with patients that are either being monitored or need help, how do you have an escalation path? And so you
Mhm.
think about, those are some base level things that nurses do, but all that is so important because technology is only as powerful as the people behind it, right? And then
Mhm.
you have nurses that can manage that process, already have your workflows embedded, then just having the right technology is going to take your skills to the nth degree. Basically,
Mhm.
technology is great as a partner, but it can't lead. People always want to think the technology is the one that makes things happen. No, it's the people behind the technology that make it successful. So
Mhm.
so if you're a nurse or and working with healthcare organizations, your skill set is going to be vital, especially in this new area of the AI that's coming, artificial intelligence. And
Mhm.
maybe we'll discuss that later. But this is going to be a skill set that you can leverage and kind of get to the next level in your career, but ultimately to help patients more in that scale.
Mhm. So one of the things I've found is a lot of nurses, they're afraid of technology. We use a lot of different EMRs in whatever setting, we have to learn that, but there's still this fear of I'm not good with tech, so what advice or what would you say to those nurses that may, they see RPM and they're like, well, that might be too much for me because it's too techy. What would you say to those nurses that, they want to do something in tech, but they're afraid it's too much, sometimes.
Yeah,
What advice would you have for
definitely,
them?
definitely. Definitely. I think, and we work with nurses all the time. And that's kind of where we talk about, that's what this training is kind of discussing a little bit about
Mhm.
understanding the right partner, right? I think, you went to school to be a nurse, not to be, tech staff, right? And so you want to find that right partner that can help guide you in that process. And just like in clinical workflows, ways to kind of manage all the complexities of managing a person's healthcare, there's
Mhm.
workflows in technology. And so if you have effective workflows that work, so for instance, if you're working with a technology partner that has cellular devices, that makes it easier for patients because they're not fumbling trying to connect it to a Wi-Fi or to a Bluetooth. And
Mhm.
patients are not getting frustrated. They just want to be able to use the device, get the reading, and make sure they're healthy and move on. And
Mhm.
so having a workflow that kind of incorporates that to understand one big thing in technology is about user testing, making sure it's simple for the user to understand how to use it if they didn't even have instructions. And
Mhm.
so that's the way you want to kind of partner with a technology company that understands and cares about the patient at such a level. So the patient who, in this case, a lot of patients we work with tend to be older. They do not have to read a lot of instructions. They can just kind of use it and move on. And then
Mhm.
if they do run into issues, you don't want them to call the patients call you about technology.
Mhm.
That's not your expertise. So you want to have a partner that has the support staff in place that can talk to patients in a calm manner, communicate clearly, so that
Mhm.
patients can get on with their day and making sure they feel heard and seen
Mhm.
as they're kind of taking care of their condition. So I'd say, when we talk to nurses, the goal is absolutely to kind of work with the right partner and
Mhm.
having partners that understand the patient journey and making sure that they deliver something that's easy for everyone to use and can
Mhm.
help you bridge the gap between technology and clinician.
Okay. So you mentioned cellular connectivity. And so I want to kind of like talk about the differences in maybe a Bluetooth device, a cellular device, and what other type of devices available for, our elderly patients to utilize, and which do you think is easiest for them to use? I mean, there are some older people, elderly people that are more comfortable with technology and they may want a Bluetooth, and there may be others who are not. So, can you tell me the difference in those devices and what advantage each of those kind of hold?
Yeah, I mean, typically anything that is not cellular enabled may be cheaper because cellular technology, if you have a cell phone, one thing you always have is a cell phone bill, right? And that's because you're connecting to a cell tower that's constantly billing you for access to the data, right? Netflix doesn't pay for itself. And so you're streaming, millions of gigs of movies and TV shows.
Mhm.
So that's what the difference is mostly, right? Because it's that monthly bill that's and so cellular devices tend to be more a little bit more expensive. When you think about Bluetooth, currently right now I have some Bluetooth earphones in my ear. So these
Mhm.
connect when they're in proximity to a device that can easily connect to it. The challenge there is if you've ever been to a car that has Bluetooth, you're on the phone and you turn your car on, you're on your phone 1 minute, next minute it's talking to the car. So
Mhm.
it's just unpredictable. And so making sure that connects correctly. So if there's a hub system in the home and you're trying to connect to it, if you're older patient, that may not be as easy for you, right? And so that could be a challenge. And then finally, you have Wi-Fi, which obviously we all have Wi-Fi in our homes at this point. But the challenge can be just like anything, Wi-Fi tends to go out. And so
Mhm.
now if for whatever reason there's a what they call SSID, a little unique identifier that allows you to connect into the Wi-Fi. If that
Mhm.
code gets erased from the device or technology, now you have a patient that's, say I've been taking my blood pressure, my weight scale measurements for the last month, and you guys
Mhm.
haven't got any of my data because the SSID just got erased and no one knew. And so things like
Mhm.
that are some of the things that, so when you kind of compare all three, cellular is
Mhm.
more expensive, but probably easy for patients to use. Bluetooth, can be useful, a little bit cheaper, but the
Mhm.
challenge would be, just unpredictability of connectivity if you don't set it up right. And then Wi-Fi is probably the cheapest, but the challenge is if there's data that you're trying to look at remotely, you may be unaware that that data is being sent. And so
Right.
making sure you kind of send those three models and three different ways of getting access to patient information is going to be
Mhm.
key. And then also all of this has to be compliant and secure. And so making sure there's no PHI, public patient health information being sent across the internet. And that's going to be key. So how do you tag that patient information,
Mhm.
back to your EMR or to your portals? And so,
Okay.
making sure that technology is secure and easy
Mhm.
to use is always the best path. And to us, that's typically how we've scaled to thousands of patients, right? Making
Right.
sure it's easy to use.
Mhm. Okay. So, what are some key considerations when a nurse is looking to select an RPM partner?
Absolutely. Yeah. So kind of, we kind of look at it, kind of hinted at a little bit before, but I would say the keys, are kind of looking at, kind of these three different areas. The first area is, let's say you ordered blood pressure devices. Now what? So the challenge there is understanding logistics. How do you get devices and technology to patients, right? The different workflows there. If I get into details, you can hand it out the office, but as you know, there's challenges there between the front desk and the doctor,
Right.
communication issues. And then you can deliver it home, but there's issues there to verify patient received it. Porch pirates are real. And so things
Yeah.
get missing at times from patients, with devices. And so tracking that information. So, the first step is talking to the vendor and understanding, what model they have. Typically, you want to a vendor that's flexible in all models, right? Understanding how to deliver it to the practice in a scalable way. So the practice knows what devices are theirs, what devices they can hand out, and how
Mhm.
easy that data can be transmitted directly back to the portal EMR. And the other way is, let's say the practice doesn't even want to deal with that, or the healthcare system, they just want to deliver directly to the patient. Do you want an
Mhm.
easy way to track that to make sure the patient got the device? So I would say working a flexible partner is number one when it comes to delivery of those devices. The next step would be kind of looking at um, the support. We kind of hinted at that when we talked about nursing. You want to
Mhm.
make sure your tech partner is, understands how to speak to older patients who are kind of working with technology for the first time, making sure it's any type of paperwork or information that's sent to the patient is easy for them to understand. If it's they speak a different language, making sure that's translated for them, or making sure you have support staff that can speak the language so that they can easily kind of understand and be more at ease. The
Mhm.
worst thing you would have is, they can't use anything and not get their information back to their doctor because they have to wait till their grandson or granddaughter get home, right, to help them. And that
Mhm.
could delay them. And also, as you know, prevent them from getting access to the needed care if their readings go off and up and down sometimes. And so making
Mhm.
sure that it's staying consistent and easy to use, and making sure the staff is there to support them. And,
Mhm.
that means like having 1-800 number, individuals who are caring and kind of walk through that process.
Mhm.
The next thing is making sure compliance. We're in healthcare.
Yes.
And obviously pandemic happened and it was the wild wild west of telehealth. And I've been in healthcare for, I've been in now for what, 15 years and now. And so before, I always think before the pandemic and after pandemic. And it was like before, I was talking about telehealth and people were like, yeah, sure, whatever. But during the
Right.
pandemic, when doctors couldn't see patients face to face and the only way to get reimbursed was through telehealth, everything
Yep.
went through the roof. And so the rules kind of got laxed a little bit, where you didn't have, doctors were providing telehealth to patients they didn't have a pre-established relationship with. They were kind of recording, reimbursements for patients that they may or may not have, gotten all the data for that met the requirements.
Right.
So what happened was, I think last year was spring of last year, they ended
Mhm.
the public health emergency, and so
Yep.
the rules kind of reverted back into where they were pre-pandemic. So
Mhm.
now doctors have to, and also check with your legal representative. This is no legal advice, but you want to
Right.
make sure you follow the regulations. Your team and your nurses making sure they follow the regulations of this process. But you want to make sure you're going through the requirements to have a patient that has a pre-established relationship. You want to make
Mhm.
sure you meet all the requirements for chronic care management, and that means nurse communication time.
Yeah.
20 minutes is 20 minutes, and you need to make sure that's documented. Because the
Yeah.
worst thing you want is for the Office of Inspector General (OIG) to come and knock on your door for an audit, and
Mhm.
and that is so key. And so having a system in place that tracks all this information and can
Mhm.
support you in case those happen, because let's be honest, sometimes will check, spot check just to see. And so making
Yeah.
sure you have a technology partner that understands that. And then
Mhm.
last but not least, you want to make sure that you have a partner that is starting to embrace AI. So artificial intelligence, this is a buzzword last year. Folks probably heard chat GPT and kind of experimenting with it.
Mhm.
What we're seeing, AI, yes, artificial intelligence could potentially be used for diagnoses, could potentially be used for, more advanced type studies. But
Mhm.
we're seeing opportunity to help with patient outreach and making sure you can scale your communication channels with patients. Artificial intelligence is really good at being able to emulate certain human kind of conversations. But
Mhm.
behind that, there needs to be a practitioner, nurse, someone that understands the patient to kind of set that in motion. So
Mhm.
instead of you communicating to maybe 100 patients, you probably can communicate to thousands of patients at the same time period with the use of AI. So
Mhm.
having systems that kind of start to embrace that to help scale yourself, but more importantly, as nurses, highly recommend everyone start to train themselves up and get familiar with that. So I
Yeah.
would say those are kind of like the four areas, looking at a technology partner that understands
Mhm.
compliance, that can help with support, help you with logistics, getting devices to patients, and also is future proof. So in case anything happens, they're prepared for the future and can help you position yourself to win new contracts if you're an entrepreneur, or help your staff if you're working with a healthcare system to be prepared for what's coming down the pipeline.
Mhm. And I had you were speaking, and then I got this other question came to me. So I know that we have different devices and stuff that we you utilize in RPM, but how do you know if it's an approved device? Is there like some type of something they go through to say, okay, well, this device is better than this one, or this is okay to use this device but not this, because um I don't see anything that really specifies, oh well, it's this device is not approved for using in RPM, or this device is there any?
Guidelines around that, yes. So FDA approval is key.
Right.
And so basically that, but within there, there's a wide range. They
Right.
want to make sure it meets, within a framework of, in some cases, plus or minus 20 of their average, blood pressure readings. So if you get three readings, you want to make sure they're all within the same range. If they go
Mhm.
wildly beyond that, then that device is considered, defective and not
Right.
approved for FDA usage.
Right.
So that's one key thing. So that's the baseline. Now,
Okay.
so that's FDA approval for any device. The second
Mhm.
level is, when you're looking at the different device levels. So the core four, typically a blood pressure, glucose scales, and pulse oximeters. So
Mhm.
those are the three, but there are other ones coming down the way, like thermometers.
Right.
They have spirometry and other things to kind of help with patient care. So, but the core four, are typically those four. And so from there, then now you kind of have to narrow down, okay, where is the most usage, and what's the easier for the patient to use. But making sure they kind of meet those parameters for FDA approval, that's pretty much the high guidelines. Now,
Okay.
there's rumors that, CMS is starting to play around with that and give more specifications around that. Remember, a lot of this was launched pre-pandemic, and then the pandemic exploded, and so
Right.
now they're starting to see data. And so the rumor is that they're looking. This is just I'm not a lawyer, but rumor is they're trying to look at and seeing, these reimbursement codes and kind of figuring out which type of kind of monitoring makes sense to pay for. So, for instance, if you're running obesity clinic and you're providing scales, should you be getting
Mhm.
paid the same amount as someone who's monitoring the temperature for patients who are dealing with, oncology, right, issues? And so
Mhm.
there may be some differences in reimbursement, based on that, the kind of model you're doing, instead of a blanket one fee fits all. But and then we'll be able to kind of determine, what kind of devices are most effective for what
Mhm.
kind of treatment you want to provide, what kind of, you know, um, indications that you need to focus in on. But right now, yes, they kind of gave the guidelines to FDA approval, and then kind of working from there.
Yeah. So that just kind of highlights the importance of staying up to date on all of these new developments, especially with RPM and CCM as well, because there are, a lot of changes, so you do have to stay on top of that. So, can you tell me a bit about what sets your company apart from others? Would
Yeah,
you?
well, and obviously, this is more try to keep it more higher level when it comes to just more education.
Mhm.
But goal, is really to kind of work directly with the practitioners and making sure they get the results that they want, which is better patient care. And
Mhm.
so, incorporating the things that we talked about, from future proof from AI to support,
Mhm. Right.
providing a sense of logistics, and then also making sure our security and compliance is in place is really
Mhm.
key for us. And so in cases, yes, there's a different price point, kind of working with us than maybe
Mhm.
someone else. But if you want security of what you're delivering to patients and to your practices that you work with, then
Mhm.
definitely this is where we kind of like to stand out. Not saying anything against other folks, but you have different type of retail organizations. You have Walmart or Target or Nordstrom's, right?
Yeah.
And depending on what direction you want to go in and where you are in your career or what you're trying to position to the
Right.
market, we feel like we want to be a little bit on the higher end, because to us, that's where we can provide the most value. And I think
Mhm.
that's the key when you kind of look at these programs, because ultimately, if it's about patient care and quite frankly, working with a lot of underserved populations, making sure they get the best care is really important to us, because some of these patients look like my relatives, right? And I feel for them that they need help. There have been countless stories where we're being able to help patients change their blood pressure readings, or save them from a misdiagnosis, or alert them to a heart attack, right? From the readings that we've gotten over the years.
Yeah.
And it's just been really, and some of the patients, just guiding them, as they get older. Some of our patients have been with us for like 3, 4 years now. And so
Mhm.
we've seen multiple things as they've gotten older. So
Right.
things like that are really kind of getting us excited about why we want to kind of position ourselves in the marketplace. But we're
Mhm.
super excited, and we really want to encourage all the nurses to think through the opportunity for artificial intelligence. I mean, this is the time to kind of start building your skill set in this area, working with organizations. If you're looking to kind of work with an organization like ours, that's a
Mhm.
skill set we're going to start needing, because we're starting to train what they call large language models to
Mhm.
understand how to communicate with patients. A
Right.
nurse needs to understand, is the model saying the right things? There's things what they call hallucinations, that the
Right.
AI say things misinterpreted things
Mhm.
differently. So having someone that can train it better to
Mhm.
understand, that's where the clinicians come into place. So this is something I encourage all your team to
Mhm.
in on the Facebook group to start, getting up to speed on. And we're looking to launch a webinar on that next week, actually, and we'll talk about that later. But those are
Wow.
some of the things that we're seeing the future and where it's going. But that's kind of our differentiator,
Okay.
having higher end and then working directly with the practitioners.
Okay. So you talked about education, being important for your company. And so I'd like you to share a bit about that education that you're talking about and what you're offering. I think you talked about a webinar and educating nurses on AI. So tell me more about that piece and, how I can get the nurses in my group, how they can learn more and how they can kind of connect with you to learn more about that.
Absolutely, absolutely. Well, I appreciate the opportunity. So I want to start with this. So when you kind of think about,
Mhm.
what's happening in the world right now, uh, the futurist Buckminster Fuller said in 1945 that the rate of all human knowledge was doubling roughly about every 25 years. So I want to ask you, do you know how long does it take human knowledge to double in 2020?
Probably, I'm just gonna guess here. Okay, I would say maybe about 6 months. I don't know.
Six months?
I could double my knowledge in no time because I have YouTube. I have so much resources just readily available to me. 6 months is a little long, but for me, I can double my knowledge. Yeah, and I say 6 months.
12 hours.
12 hours.
So
Wow.
every 12 hours, the whole of human existence is
Yeah.
doubling knowledge. So think about that. Not only
Mhm.
is trillions of data points that we're
Yeah.
learning, that
Mhm.
just got doubled since you woke up this morning. And then there's gonna be another double. So I say that not to scare everyone, but just to show them
Right.
that, the ability to learn all this stuff is just impossible for one person.
Mhm. Right.
Other kind of stat I saw was that um, Goldman Sachs, I don't know if you saw this stat, said that in the next 5 years, 300 million jobs will be replaced by AI, artificial intelligence. So when we
Right.
first thought about AI, artificial intelligence, we thought, hey, it's going to come in, computers are going to, take our trash out, sweep up the yard. No, it's coming after knowledge workers, right? It's coming.
It is. It really
That's
is.
why Hollywood went on strike. They were creators, writers who were scared of AI coming and writing scripts. Likewise, there are technology companies now, roughly about 75 billion is spent in
Mhm.
AI venture capital funding for companies that are building out chatbots that sound like nurses.
Sound like
Um,
nurses. Yep, exactly.
exactly. So I say all that to say is this is an area that we're super kind of excited about and we really want to kind of get the word out there. And so we're experimenting with AI and we
Mhm.
think the opportunity is immense. So if you're looking for remote opportunities, understanding the training that you need, yes, you can get the books, yes, you
Mhm.
can get coach, you can do all these things, but the opportunity exists because number one, you can probably help your healthcare organization future-proof themselves if you're
Mhm.
already working, higher up. You can work with a technology company, right, and kind of lead their practices, understanding the clinician side of it. You
Mhm.
could come in as a entrepreneur and really kind of guide new companies in the area in this space, or
Mhm.
you can kind of get on the job training and to understand new areas of pathways to kind of grow. And
Mhm.
so there's just different opportunities, as a nurse you can kind of go after when they kind of think about all the different pathways when it comes to AI opportunities. And so, what we're offering is next Wednesday, and if anyone wants to check it out, it's ainursecoach.com/webinar, and I'll put in the chat box. But
And
basically, the goal.
share the link with me. I can post it in the group as well. So if they want to learn.
Absolutely. Yeah. It's a free webinar, and we'll talk about that and get everyone excited about the new opportunities there. And
Mhm.
yes, that's kind of something that we want to start kind of communicating, AI nursecoach.com webinar. And really, the goal for this webinar is really just a more deep dive into this space and area, but really also how incorporates into remote care programs
Mhm.
as well.
Yeah.
And so that's some of the things that we want to kind of talk about and get people excited about. But yeah, so that's where we're trying to go in the future. And this goal here today was just kind of exposing the other side. I know you guys have all worked with technology companies, and so you kind of get a sense of what we're thinking about. So this is your chance to kind of pick our brain.
Mhm.
Obviously, if you have interest in SensorMed, learning more, go check us out at sensormed.com. But really, we're here to kind of add value to this group and show, what's possible for the future.
All right, well, great. And I certainly have been using AI as well. I've integrated that into my course for nurses as well. So I'm sure that they would look forward to learning more from you on the AI, and being able to utilize their skills in that way. So I'm going to get ready to close out. Is there anything else that you wanted to share today?
No, I just want to thank you, Natasha, for building this group up and getting people excited about the opportunities of remote care and entrepreneurship and the opportunities. I just want to encourage every nurse out there that this is your
Mhm.
time. My wife is a nurse.
Mhm.
She has that passion to go out after it. You guys already have the knowledge. You're used to learning new things. So
Mhm.
this is just a outgrowth of that. You've done it before. Now
Mhm.
it's the next step to this new area of healthcare. And so if there's any way I can do to kind of help in that transition, please, have your team reach out. But
Mhm.
I'm super excited about this organization and what you're building on Facebook, and I definitely think there's new more to come. So we're just in the early innings. This is not the
Yes,
end,
in
the
the early.
beginning of something new. And so I want everyone to realize this is the most transformation. I'm sure you've probably seen just in healthcare in general. And
Mhm.
so I'm super excited about what's happening here. So definitely go check out the webinar next Wednesday, ainursecoach.com web/webinar. And then if anyone wants to check that out, we'll go more deep dive on the opportunity around AI. But yeah,
Okay.
thank you for this time. I really
All
appreciate it.
right. Okay. Thank you so much, Theo.
All right. Have a good one, everyone.
Thanks.